Hello everyone, my name is Seth, and today we will be looking at if there is evidence that ultrasound is effective in wound healing. So here's a video that quickly shows how ultrasound works.
The heart of most ultrasound systems is a device called a transducer, which uses an array of piezoelectric crystals. A piezoelectric crystal vibrates when an electric signal is applied, producing high-frequency sound pressure waves, which we call ultrasound.
So just keep in mind that there are various different types of ultrasound. However, we will just focus on one of those types that, in my opinion, is better suited for wound healing, and that is therapeutic ultrasound. So there are two forms of therapeutic ultrasound. There's thermal or continuous and non-thermal or pulsed. So thermal ultrasound is a form of mechanical energy that causes oscillation of the particles within a tissue, leading to friction between those particles, which results in heat. In non-thermal ultrasound, sodium and calcium ion interactions within the cells are altered, and the energy from the ultrasound also acts to increase cellular activity, which leads to various therapeutic benefits that we will cover. So the non-thermal effects are produced by cavitation, which we have talked about, which pretty much is gas or little energy bubbles, and acoustic streaming, which is a collection of fluid around the cell. So before we go on, it's important to uh, look at wound healing and the inflammation process as they pretty much go hand in hand. And we will look at what ultrasound does in the three phases of inflammation. So in the inflammatory phase, ultrasound pretty much speeds up this phase by enhancing the release of histamine, which signals the body to send healing properties to the site of inflammation or the site of injury. In the proliferative phase, it increases blood vessel growth and also increases fibroblast migration, proliferation to create new collagen. The remodeling phase, it alters the orientation of scar tissue, speeds up the maturation process of collagen from type 3 to type 1. So getting into our first article, the purpose of this study was to look at low frequency, low intensity ultrasound as an effective treatment of venous stasis ulcers. They took 20 participants with venous ulcers and separated them into 4 groups. Every group underwent standard of care wound treatment while 3 groups underwent ultrasound under various parameters. And you can see the outcomes at the bottom, and they found pretty much that 20 kilohertz, 100 megawatt centimeters squared for 15 minutes had the best results, that being zero point 0.1 watts and 0.2 megahertz. And there is a picture from the study of 2 different patients in the different groups, which I thought was pretty cool to see. And also here is just a little picture of how their setup was that they used for the wound. So the strengths of this study was that the sham group and treatment group had nearly identical initial wound size. That's the measurement there. And the weakness for this study was that there was a small amount of participants, and it didn't describe the specific requirements that they had for the wounds to be considered healed or unhealed. So for our next article, this study looked at the effects of non-contact low-frequency ultrasound, or NLFU, at the microscopic level. They took tissue samples throughout 4 weeks of ultrasound treatment from 36 participants who had chronic venous leg ulcers. Picture at the bottom shows the various locations where they took tissue samples on one of the patients. It is also important to note that they used mist therapy for this. So it wasn't just standard ultrasound, it was mist therapy ultrasound. They found that NLFU treatment decreased abundant levels of pro-inflammatory cytokines and showed a significant reduction of fibrinogen and biofilm, or bacteria. This is considered very beneficial as you want to avoid the excessive inflammation in chronic conditions such as these. So the strengths for the study was that it explored the in vitro effects of NLFU in chronic venous leg ulcers. The weakness was that the measurement process used to assess wound size was not very well documented. So for our next article, this study looked at the effects of ultrasound with UVC or ultraviolet C, light and laser treatment on pressure ulcers resulting from spinal cord injury. So 9 patients received standard wound care treatment 6 received laser treatment along with SWC, and 5 received daily alternating US and UVC treatment along with SWC. They found a mean percentage change per week in ulcer size from day 0 until end of treatment to be 32.4 for the control group, 53.5% for the US/UVC group, and 23.7% for the laser group. So the results show that ultrasound and UVC had the greatest positive effects, obviously, on wound healing when compared to the other two groups. So the strengths of this study was that every patient received standard wound care treatment no matter what group they were in, and the weakness was that 4 subjects did not complete the study and withdrew for various reasons, and ultrasound was also not isolated from UVC. So the fourth article, this study looked at the effects of low frequency contact ultrasound debridement, or LFCU, on wound healing, and they took 68 participants with a full thickness wound below the knee who received SWC, and one group received ultrasound treatment in addition to that. So a wound assessment tool, or the REV-PWAT, was used to grade the wound, and they found that the scores improved by a mean of 7.34 for the LFCUD group and 2.98 for just the standard wound. And 33.3% also healed in the experimental group, while only 8.3% healed in the control group. And they concluded that LFCUD, alongside usual wound care, showed a significant improvement in wound size reduction and appearance. And the strength of the study was that it was a randomized controlled trial, and it is relatively recent. The weakness was that participants were unable to be blinded to which treatment they were receiving. So our last article, this study looked at the effects of ultrasound and standard wound care treatments in 15 patients compared to just standard wound care in a second group of 15. So they started with 30. And the parameters used for ultrasound in addition to daily standard wound care were 10-minute daily at continuous pulse, 3 megahertz frequency, and 0.8 watts per centimeter squared. And they did these treatments for 4 weeks daily, like I said. And they found that the ultrasound group final ulcer surface area significantly decreased after 4 weeks, and the mean wound surface area consisted as the numbers in the outcome section. So the strengths of this study was that both groups received treatment daily for 4 weeks, and the weaknesses was that the study was performed outside the US and it was pretty easy to be misinterpreted. So when I was doing research, I came across this statement and felt like it was a great explanation of the body's physiological response to ultrasound. So pretty much to paraphrase it, ultrasound stimulates healthy cells via cavitation and acoustic streaming and makes bacteria more vulnerable to antibiotics and promotes healing by increasing fibrinolysis and cellular activity. So here are some of the effective parameters used based on the articles I researched. And because there was significant statistical evidence that ultrasound is effective in wound healing, it is definitely encouraged to use this physical agent alongside standard wound healing treatment. And here's a picture of Master West agreeing. And so this is something that I will definitely utilize if I ever get the chance to do wound care. Yeah.